So we can see the Minister.
You should know to put him on short.
That's fine, good help.
We're away.
Well, we need to give a COVID update today, and before I do, can I welcome Mikey back? And it's great to make sure that we are able to communicate with all of the public in relation to these important updates. With COVID today, we've got 6,768 new cases reported. Importantly combined, we have 928 hospital beds across our public and private system of COVID and influenza cases. This means that we have almost the same number of beds being taken up at our peak of the first wave of Omicron. We know that we've probably got another 2 or 3 weeks before we hit this peak, and we expect these numbers to climb. I also have 2,311 health staff across the public system that are furloughed as at today because of COVID. So with the staff pressures and the extra hospital beds being taken up with COVID and the flu, this is putting pressure on our system. We are seeing the majority of our hospital and health services have gone on to Tier 3, which means they are suspending some of their planned care. We are leaving it to the individual HHSs and the hospitals to determine what level of suspension of planned care based on their staff shortages and their COVID bed numbers, as some will be able to do more planned care than others. And we believe that this is, at the moment, the appropriate way to manage the demand across the health system. Also, our wonderful health staff are managing over 1,700 people in our virtual care with our hospital in the home. And this has been one of our initiatives over 2022 since Omicron came on, to manage people in the home as well, particularly vulnerable people who just need to be monitored closely but don't need hospitalisation. And I want to thank all the staff who have been managing these people in their homes as well. The AHPPC have advised that they are changing the rule around isolation, where if someone has had COVID previously, the rule has been that you do not need to get tested and isolate again unless it had been 12 weeks. AHPPC have now advised that that is back to 4 weeks, because we do know that people can get reinfected and reinfected quicker with the BA4 or 5. So that means if you have symptoms, you've had COVID recently, but you have symptoms and it's been 4 weeks or more since you had that previous case of COVID, that you should test yourself. And if you are positive, you will need to isolate for 7 days again. So this is an important measure that we need people to be aware of. And this is a decision that's been made by AHPPC, advising all states and territories to take this course. When it comes to mask wearing, we continue to reiterate to people, if you're particularly vulnerable, then we recommend you wearing a mask in indoor settings. And of course, anyone else who finds themselves in high density areas that feel the need to wear a mask should do so. It is still mandatory on public transport, on planes, and in health settings such as hospitals, disability and aged care, and I do remind people that you must wear a mask in those settings. Otherwise, please make sure you're carrying a mask with you and you're staying safe as we see these numbers of COVID cases growing in our community. I'll now hand over to the Chief Health Officer.
Thank you very much, Minister. As expected, the COVID case numbers continue to climb, and the peak of this current wave is not expected to be reached before the beginning of August. So there are 6,768 new cases to report in the last 24 hours, 5,298 from positive RAT tests. That brings the total number of active cases to 43,047. 755 people in public hospitals, including 9 in ICU. But interestingly, there are still only 4 ventilated patients on life support. In fact, that's across both the public and private sector, despite the large number of inpatients in our hospitals at the moment, and that will be because of vaccination. So vaccination is preventing the very sickest, most of the very sickest cases from occurring. I'm speaking to my colleagues in hospitals. The patients we're mostly seeing are people being admitted at ward level, sometimes needing oxygen, mostly elderly, mostly over the age of 60, 65, sometimes needing oxygen, sometimes just needing some supportive care. The relative numbers of patients in intensive care remains small. There are 105 patients in private hospitals. That includes 3 people in intensive care, but none of those 3 are on life support. In terms of the wave of BA.4/5, of the most recently sequenced viruses of the last 2 weeks, now 70% of the viruses sequenced in the last 2 weeks are of the BA.4/5. So clearly the BA.4/5 subvariants are becoming dominant. It's mostly BA.5. BA.4 and 5 are closely related, but it's mostly BA.5 at present. There have been 10 known deaths from the BA.4/5 subvariants. 8 of those 10 were not up to date with vaccination. 2 had 4 doses, were from aged care facilities. So just remind everybody that a 4th dose of the vaccine, the COVID vaccine, is available to everyone over the age of 30, but it's most important in older people, and it's advised now for anyone over the age of 50 since those changes in the ATAGI recommendations, particularly over 65, but advised for anyone over the age of 50. And again, I'll also remind you that the COVID medicines, that's molnupiravir and Paxlovid, are available more widely available since changes on Monday. Anyone over the age of 70 with COVID in the first 5 days can receive those medications, and anyone over the age of 50 but with 2 comorbidities, 2 other conditions are eligible. I would remind everybody that mask wearing remains mandatory on public transport in healthcare settings, including aged care, and we strongly advise mask wearing in crowded indoor environments. Other updates in terms of the Coral Princess. Coral Princess left Brisbane, the port of Brisbane, on Monday. It's currently in New South Wales waters, where there are 118 cases on board, 114 crew and 4 passengers. 24 passengers of the Coral Princess with COVID-19 disembarked in Brisbane, and all are isolating and are relatively well. I'll just keep going. It's other information. Influenza. We have 156 new influenza cases, 1,861 active influenza cases. There is a clear decline in the number of influenza cases. This wave of influenza has clearly peaked, and the numbers are declining. 77 influenza patients in public hospitals, including 7 in ICU at the moment. There have been a total of 48 deaths from this current influenza wave. The Hendra situation in Mackay. You would be aware that a horse was euthanized a number of days ago. 2 close contacts of that horse have been given the monoclonal antibody treatment in Mackay to prevent them becoming infected. And we have 1 low-risk contact with mild respiratory symptoms who's being tested for Hendra. We think it's unlikely they have Hendra, but we're waiting for those test results to come back. And you would be aware there's just 1 monkeypox case that was reported recently who's recovering.
That's 928 in hospital with COVID and the flu. Is there a breakdown? You said 77 had the flu, so that 900 is very close to that peak of 1,000 it would be.
Yes, that's correct. Well, the 1,000 cases refers to the COVID specifically, and we have We currently have 755 patients in public hospitals and 105 in private hospitals. What's that? A total of 860. It's getting close. No, yes, and it's getting close, and well, it's not hard to imagine that it's going to exceed that 1,000 number, given that we still predict the peak won't be until the first week of August at the earliest. It may be later, but that's current.
Prediction of what it will look like in August then, given we're so close?
No, we don't. We get 4-week projections, and there will be further projections that will be coming to us soon. But at this stage, that is the number that we still have at the moment.
A number of public hospitals have set up tent triages outside emergencies. Why is that?
I think a number of them have been like that for a while. I think that's quite a useful. That's been very useful. They're not just simple tents; these are marquees. They're quite sophisticated facilities, and they allow spacing of patients. It's a good environment to manage these patients.
Are you at all concerned about monkeypox?
No, not particularly. No, there's no general risk to the public. I mean, it's a general principle. I think we're going to see monkeypox spreading. There'll be more cases in the future. I mean, it's not something that we should be losing sleep over, but it seems like it's well established around the world now.
And is there a test? I mean, there's a PCR test. How do you do
a swab of one of the
swab
lesions,
yeah.
and do a PCR on the material from the swab.
Given the peak is weeks away, and you still don't know when it is exactly, are you considering any more public health measures?
No, not at this stage. The mask use, as it is outlined, is what we will continue. I think the idea of actually having general mandates for indoor wearing of masks is not something we'll be considering in this wave.
And the Victorian Health Minister today said she hasn't accepted the advice of the Victorian Chief Health Officer with regard to masks. Has the Health Minister accepted all your advice?
Yes. Yes, she has.
What would it take to trigger more restrictions?
It's unlikely that it will happen in this wave. These waves are going to continue for some considerable time, and the idea of introducing mandates, withdrawing them, it's just not the way to go. The best we can expect from a mask mandate may be a slight blunt. It's hard to tell, so it's not something that we're considering in the near future.
More than 1,300 people have died from COVID this year, one of the top causes of death. It's a public health failure, isn't it?
Not at all. Not at all. I think it's a public health success so far, our response to COVID-19, insofar as in the worst pandemic in 100 years, we've been able to successfully vaccinate 93% of the Queensland population and protect the vast majority of us from serious disease. So this overall, any death, of course, is a tragedy, and for the individuals involved and the families involved, this has no meaning. But in terms of an overall public health response, it has been extraordinary.
Should the ECA still go ahead, given it will happen around?
Yes, absolutely.
Well, the changes from the 12 weeks to the 4 weeks isolation period from exposure to COVID, are you worried about the impact that might have on health workers, given you've already got so many furloughed, either in isolation or with the virus?
Well, what it means is that if you get sick within 4 weeks of having COVID-19, you should test again for COVID-19. But if you're sick and you should be isolating anyway, the impact, it's hard to see whether this will be a big impact. It really is if you're sick and you test positive for COVID-19 between 4 and 12 weeks, now you need to isolate for 7 days as opposed to until you get better. The impact, I'm not sure that it will be that great.
Are there any hospitals in particular that you can name that you're particularly worried about at the moment, facing a shortage of workers? It's pressure
right across the system. It's right across Queensland, right across the country.
Do you have any update on the Woorona Aged Care Home in Charleville? Any more infections, and how are the residents there?
I don't have a specific update. My understanding is that we were sending some staff support to that facility. I heard that yesterday. I don't have the details though.
Do you know how many aged care homes across the state are dealing with outbreaks at the moment?
I don't. I'm sure it will be many. It's not surprising. The virus is widespread. Most of the outbreaks that are occurring in Australia have been small in scale, but they are widespread.
Are the cruising protocols adequate?
The cruising protocols are very adequate. There is there's a great deal of detail in those protocols and requirements on the cruising industry and what is required. So yes, there's a considerable thought from public health officials and epidemiologists have gone into putting these protocols in place.
Paul Kelly this morning said, given the number of cases in the community, we should expect outbreaks like this on cruise ships.
Yes,
Correct?
yes, that's inevitable. And anyone who goes on a cruise ship will be hopefully up to date with their vaccines and largely protected.
Dr. Gerrard, just on the cruise ship protocols, do they actually have to provide proof of a negative RAT before boarding?
That is my understanding. I'm not fully around the detail. I believe that is the case.
We've spoken to dozens of them now to say you just have to say that you have done the test. You don't actually have to provide any proof.
Okay, I'm not around the detail.
Is
I'm
that
sorry.
good enough? If just say, should you have to provide proof that you are negative?
I think to keep this virus off these ships where there are thousands of people in the middle of a pandemic is extraordinarily difficult.
So those 4 patients on board at the moment who tested, 4 passengers who tested positive, has that just been since the cruise departed Brisbane? Have they become sick? Do we know?
I believe so. Yes, I think that is the case. I'm not certain.
I'm so sorry, it's a little late, so please explain here. Just a question on masks.
Yes.
Is it time to bring some sort of mandate back?
Well, we already have mandatory masks in public transport, in healthcare settings, in pharmacies, and at aged care, and we strongly encourage people to wear masks in crowded indoor environments. But a wide-scale indoor mask mandate is not something that we're looking at the moment.
Our booster rates are really low in Queensland compared to other states.
Yes.
Are you concerned that message is just not getting through to the
Well, my
wider
understanding is there's been significant uptake in the last 24, 48 hours, and I think the message is getting through.
public? And we did see in previous peaks people starting to panic and call triple O when they felt they were having serious respiratory symptoms. Have we seen any increased pressure on triple O calls?
I don't know specifically.
Thank you very much. Thanks, guys.
Thank you.
Thanks, John.
Thank you.